What if I told you that the American healthcare system isn't broken, it's just working against you? That those outrageous hospital bills, the sky-high prescription drug prices, and the confusing insurance policies aren't accidents, but the result of a system designed to put profits over patients? If you've ever felt powerless against the medical-industrial complex, you're not alone. We've all heard the horror stories: people going bankrupt from a simple hospital visit, families drowning in medical debt, patients getting denied life-saving treatments because of fine print in their insurance policies. It's easy to assume this is just the way things are, but that's exactly what the system wants you to believe. Elisabeth Rosenthal's An American Sickness breaks down how healthcare in the U.S. became a business, one that thrives on secrecy, overcharging, and keeping patients confused. But more importantly, this book arms us with the knowledge to fight back. And that's exactly what we're going to explore today. By the end of this video, you'll understand why healthcare in America is so expensive, who's profiting from it, and most importantly what you can do about it. So if you've ever felt trapped in this system, stick around, because this might be the most important conversation about healthcare you'll ever hear. Have you ever opened a medical bill and felt your stomach drop? Maybe you went in for something simple: a blood test, a quick ER visit, a routine checkup, only to be hit with a number so big it made you question reality. Why does healthcare in America feel less like a service and more like a hostage situation? Elisabeth Rosenthal's An American Sickness pulls back the curtain on this madness, showing how medicine has transformed from a compassionate profession into a corporate machine that treats patients like profit centers. Hospitals, insurance companies, and pharmaceutical giants have turned what should be about healing into an industry obsessed with revenue. And the worst part? We've been conditioned to accept it. Think about it. In what other industry do you buy a service without knowing the price beforehand? Imagine going to a restaurant, ordering a steak, and getting the bill weeks later: $500 for the meat, $200 for the plate it was served on, $50 for the silverware. That's exactly how medical billing works. Prices are arbitrary, confusing, and designed to keep patients in the dark. Rosenthal doesn't just diagnose the problem, she traces the disease. How did we get here? It started with good intentions, with health insurance meant to protect people from financial ruin. But over the years, insurers realized they could make more by charging more. Hospitals saw that bigger bills meant bigger reimbursements. Drug companies learned they could manipulate patents to keep prices high. And so, the system snowballed, driven by one unspoken rule: more treatment always means more money. But here's the kicker: more treatment doesn't always mean better health. In fact, sometimes, it does the opposite. Unnecessary tests, overprescribed medications, and aggressive procedures can harm patients, all while racking up enormous bills. And yet, we've been taught to equate more care with better care. So, what can we do? For starters, be an active patient. Ask for an itemized bill. Compare prices before procedures. Push back on unnecessary tests. The internet has tools that can help you find fair prices for medical services. And if you're insured, don't just assume your provider is getting you the best deal. Often, they're paying inflated prices without question. On a bigger scale, real change means demanding transparency. Why should hospitals be allowed to hide prices? Why do we tolerate a system where an uninsured person pays more than someone with insurance for the exact same service? Change won't come from within, it has to come from us, the patients, the people stuck in this maze of bills and bureaucracy. The truth is, the healthcare system in America isn't broken, it's working exactly as it was designed. The question is, are we okay with that? If the American healthcare system feels like a scam, that's because in many ways, it is. Let's break it down. Why is everything so expensive? Why does the same treatment cost wildly different amounts depending on where you go, what insurance you have, or even which doctor sees you? The simple answer: healthcare has become big business. Instead of focusing on healing, hospitals, insurance companies, and pharmaceutical firms prioritize profits. And while they'll tell you it's about innovation or better patient outcomes, the truth is a lot darker. Let's start with hospitals. A place that should be about care has turned into a financial monster. Walk into any major medical center, and you'll find a pristine lobby, artwork on the walls, and even a waterfall in the waiting area. These hospitals don't just charge for treatments, they charge for the experience, and they pass those costs on to you. Ever wonder why a simple Tylenol in a hospital costs $50? Or why an MRI can range from $400 to $4,000 depending on where you get it? It's because hospitals set their prices based on what they can get away with, not what's fair. And insurance companies? They go along with it, paying out absurd amounts and then raising your premiums to cover the cost. And that brings us to insurance companies, the gatekeepers of care who claim to be on your side. Originally, insurance was meant to protect people from financial ruin. But now, insurers are playing their own game, one where they benefit more when healthcare is expensive. The higher the medical bills, the more they can justify raising premiums. And because they negotiate secret deals with hospitals, there's no real incentive for them to push back on outrageous costs. Instead of keeping prices fair, they've learned how to profit off the chaos. Think about it, if you get a bill for $20,000, and your insurance graciously negotiates it down to $5,000, they'll tell you they saved you money. But did they? Or did they just allow hospitals to inflate prices, so they can swoop in like heroes? The truth is, that bill might have only been worth $1,000 in the first place. Then there's Big Pharma. If you've ever wondered why medications in the US cost 2, 3, or even 10 times what they do in other countries, it all comes down to one thing: patents and profits. Drug companies use loopholes to keep generic alternatives off the market for as long as possible, extending their monopolies and jacking up prices. And they don't just charge what's fair, they charge whatever the market will bear. That's why insulin, a life-saving drug that's been around for a century, costs hundreds of dollars a month in America but is available for a fraction of that price in Canada or Europe. And it's not just drugs, medical devices follow the same pattern. If you need a knee replacement, a pacemaker, or even something as simple as a glucose monitor, the price isn't based on what it costs to make. It's based on how much money companies think they can squeeze out of hospitals, insurers, and ultimately, patients. But here's the scariest part: more healthcare doesn't always mean better healthcare. We've been conditioned to believe that if a doctor orders extra tests, more scans, or a longer hospital stay, it's because we need it. But that's not always true. Hospitals and doctors are often incentivized to do more, not necessarily because it benefits the patient, but because it brings in more revenue. A simple knee pain complaint can turn into MRIs, injections, and even surgery when physical therapy might have been enough. And what happens if you question it? Many patients feel powerless in front of their doctors. You don't want to seem like you're second-guessing a professional. But sometimes, asking, "Do I really need this?" can save you thousands of dollars and even unnecessary treatments. So, what can you do? First, be an informed patient. Always ask for the price before a procedure. It might feel awkward, but imagine if no one ever questioned a restaurant bill. You'd be charged whatever the chef felt like. Use online tools to compare prices for tests and procedures in your area. And don't be afraid to negotiate your medical bills. You'd be surprised how often hospitals lower costs if you push back. Second, rethink how you choose insurance. Not all plans are created equal, and just because a company says they cover something doesn't mean they're getting you a good deal. If you're self-employed or have options, look into direct primary care models, where you pay a flat monthly fee for unlimited visits. In some cases, these alternatives save money by cutting out insurance middlemen altogether. Third, demand transparency. Hospitals and insurers rely on secrecy to keep prices high. If we, as patients, refuse to accept mystery pricing, if we ask for itemized bills, compare costs, and push back against absurd charges, we start changing the rules of the game. And finally, advocate for systemic change. Other countries have figured out how to provide healthcare without bankrupting their citizens. The US spends more on healthcare than any other developed country, yet our outcomes are worse. That's not a failure of medicine, that's a feature of a system designed to prioritize profits over people. The problem isn't that healthcare is expensive, it's that it's artificially expensive. We've been taught to accept the unacceptable. But the more we understand how this system really works, the more power we have to fight back. Because at the end of the day, healthcare should be about healing, not billing. The next time you see a medical bill that makes no sense, don't just sigh and pay it. Ask yourself who's benefiting from this. Because one thing is certain, it's not the patient. So, now that we know how the American healthcare system is ripping us off, what can we do about it? It's easy to feel overwhelmed, like we're just tiny fish in a vast ocean of big hospitals, insurance companies, and pharmaceutical giants. But here's the thing, even small actions can lead to big changes when it comes to your health and your wallet. Let's break down what you can do, starting today, to navigate this chaotic system. First, let's talk about being a proactive patient. Have you ever looked at a medical bill and thought, what even is this? Maybe it was a charge for a service you never received or a mysterious fee that made no sense. The reality is, hospitals and doctors are banking on the fact that most of us won't question these charges. They assume we'll just pay up or let insurance handle it. But questioning these bills is one of the most powerful tools you have. Start by asking for an itemized bill. If you're in the hospital, request it before you leave. It's a lot harder for them to pad the bill when they know you're watching. And don't be afraid to negotiate. Yes, you can negotiate your medical bills just like you would a car or a house price. Hospitals often have programs to reduce bills for people who ask, sometimes cutting your cost by 20%, 30%, or even 50%. So the next time you get a bill that seems outrageous, don't just grimace and pay it, pick up the phone and ask for a reduction. You'd be amazed at how often it works. Now, let's tackle the insurance maze. Choosing the right insurance plan can feel like trying to pick the least painful option in a torture chamber. But being strategic can save you thousands of dollars. Look for plans that cover the hospitals and doctors you trust, but also check their negotiated rates for common procedures. Sometimes, paying a bit more in monthly premiums can save you a fortune in out-of-pocket costs if you end up needing significant care. And if you're self-employed or your employer's insurance is too expensive, consider direct primary care or health-sharing ministries. Direct primary care works like a subscription service. Pay a flat fee each month, and you get unlimited visits and discounted tests. It's like having a doctor on speed dial without the insurance middleman inflating costs. Health-sharing ministries are another alternative, where members pool funds to cover each other's medical expenses. It's not insurance, but for many, it's a lifesaver. What about prescription drugs? We all know someone who's had to choose between paying rent or buying medicine. But there are ways to lower these costs too. Always ask your doctor if there's a generic version of the medication you're prescribed. Generics can be up to 90% cheaper than brand-name drugs, and in most cases, they work just as well. Also, shop around. Yes, you can shop for prescriptions like you shop for groceries. Use websites and apps like GoodRx to compare prices at different pharmacies. The price of the same drug can vary widely even within the same zip code. And if you find a cheaper price online or at another pharmacy, ask your local pharmacy to match it. Many will, just to keep your business. Ever think about going digital with your healthcare? Telemedicine has taken off, especially after the pandemic, and it's not just for minor ailments anymore. From therapy sessions to dermatology consults, telemedicine can save you time and money. No need for expensive ER visits or waiting weeks for an appointment. Sometimes, you can get diagnosed and treated from your couch. Plus, virtual visits are often cheaper than in-person ones, and some insurance plans even cover them fully. Let's not forget about preventive care. We often think of healthcare as something we need only when we're sick, but the best way to save money and stay healthy is to prevent problems before they start. Take advantage of free annual checkups, vaccines, and screenings. These are usually covered 100% by insurance because catching something early is much cheaper than treating it later. So, schedule that annual physical, get your flu shot, and don't ignore those reminders for cancer screenings. Now, let's talk about the elephant in the room: government and policy. We can't fix this system just by being savvy consumers, we need real change at the legislative level. Get involved. Call your representatives. Tell them you're tired of paying more for healthcare than any other country while getting worse results. Support laws that require price transparency from hospitals and drug companies. And push for caps on out-of-pocket expenses so no one has to go bankrupt because they got sick. Community activism is powerful too. Join or support local healthcare advocacy groups. Sometimes a small, organized group can make waves, whether it's fighting for lower drug prices or pushing back against hospital monopolies in your area. And when it comes time to vote, think about candidate stances on healthcare. Real change starts at the ballot box, and our votes can either prop up the current system or tear it down for something better. But let's be real, it's not just about policy and laws. It's about changing our mindset. We need to stop thinking of healthcare as a luxury and start seeing it as a right. Imagine a world where you don't have to second-guess a trip to the doctor because you're worried about the cost. A world where your zip code doesn't determine whether you survive a medical emergency. It might sound like a dream, but it's possible if we demand it. So, here's your action plan: be a savvy shopper when it comes to your health. Question every bill, compare every price, and never assume your insurance has your back. Educate yourself on alternative care models that might fit your needs better than traditional insurance. Advocate for change, both locally and nationally. And perhaps most importantly, support and vote for leaders who prioritize affordable healthcare for all. Remember, the system won't change overnight, but every action you take chips away at the power these corporations have over us. When we all start questioning, pushing back, and advocating for better, that's when the system starts to shift. It's your health, your money, and your future. Take control of it. So, we've talked about the problems, we've talked about the solutions, but there's something else we need to address, something most people don't even realize. A blind spot. And like any blind spot, if you don't see it, you can't avoid it. Here's the thing, most of us assume that if we just follow the steps, if we question bills, shop around, vote for better policies, we'll eventually fix healthcare. And while those things are powerful, they only address part of the issue. Because there's a fundamental flaw in how we think about healthcare in America. We still believe the system is supposed to work for us. Let's be real. When we hear about how expensive healthcare is, we assume it's broken. But what if it's not? What if this system is functioning exactly as it was designed to maximize profits? Because the truth is, the American healthcare system isn't failing, it's succeeding at making money. And the sooner we understand that, the sooner we can start demanding something different. Think about it. In any normal industry, when competition increases, prices go down. More choices mean better deals, right? That's how capitalism works. But in healthcare, competition actually drives prices up. Hospitals merge into massive conglomerates, insurance companies carve up the market, and pharmaceutical companies patent drugs in ways that keep prices high. They don't compete to be cheaper. They compete to be bigger, more powerful, and harder to regulate. And we, the patients, are left with no real choice. Another blind spot. We assume insurance protects us. But in reality, insurance companies are middlemen profiting from the system's complexity. They claim to negotiate better rates, but in many cases, they go along with hospitals' inflated prices. After all, the higher the bills, the more they can justify raising premiums. And since most of us don't understand how the system works, we accept it. We also fall for the illusion of more care means better care. Have you ever noticed how American medicine tends to throw tests and treatments at every little problem? Got a headache? MRI. Minor knee pain. Let's do surgery. But in many cases, these aggressive treatments aren't necessary and sometimes, they're even harmful. In other countries, doctors focus on long-term wellness and prevention, but here, every extra test, every extra night in the hospital, is another charge on your bill. And here's a big one: personal responsibility. We're constantly told that if people just lived healthier lives, we wouldn't have such expensive healthcare. But while lifestyle choices matter, that's not why our system is broken. People in other countries smoke, drink, and eat junk food too. Yet their healthcare costs are still a fraction of ours. Why? Because their systems are designed to prioritize care over profit. So, what do we do about it? First, we need to change the conversation. Stop talking about healthcare like it's just a consumer issue, where we need to shop smarter. Yes, being an informed patient helps, but real change requires something bigger. We need to push back against the entire idea that healthcare should be run like a business. We need to stop accepting that a trip to the ER should cost more than a luxury vacation. Second, we need to recognize that small tweaks won't fix this. Many well-meaning politicians propose reforms that only scratch the surface. Adding price transparency or capping certain fees helps, but it doesn't address the root cause, a system built on profit-driven care. We need bold changes, ones that fundamentally shift how healthcare is structured. And finally, we need to stop blaming ourselves. If you've ever felt guilty for not understanding your insurance plan, for being overwhelmed by medical bills, for not shopping around before an emergency, let that go. The system was built to confuse you. It was built to make you feel powerless. But now that you see it, you don't have to accept it. The American healthcare system isn't broken. It's just working against us. The question is, are we going to keep playing by its rules, or are we going to change the game? Alright, so now that we've broken down the American healthcare system, what's next? How do we keep learning, keep questioning, and keep pushing for change? Because understanding this issue isn't just about saving money on your next doctor's visit, it's about seeing the bigger picture. And once you see it, you can't unsee it. If an American sickness opened your eyes, there are other books that will take you even deeper. One of them is The Price We Pay by Dr. Marty Makary. It's written by a surgeon who has seen firsthand how hospitals and insurance companies manipulate pricing, and it lays out how medical bills are deliberately designed to be confusing. He also exposes the rise of predatory medical billing cases where hospitals sue patients, garnish wages, and send debt collectors after people who had no idea they were being overcharged in the first place. If you want to understand why medical debt is the leading cause of bankruptcy in the US, this book is a must-read. Then there's The Healing of America by T.R. Reid. This one is fascinating because it steps outside of the US bubble and explores how other countries handle healthcare. Spoiler alert, almost every developed nation gets better health outcomes for half the price. Reid breaks down different models: universal coverage in the UK, government-subsidized insurance in Germany, private but affordable care in Switzerland, and asks a tough question: if they can do it, why can't we? It forces us to think beyond our broken system and realize that better options already exist. If you want a deeper dive into the history of American healthcare, check out Sick: The Untold Story of America's Healthcare Crisis by Jonathan Cohn. This book goes beyond economics and policy; it tells the human stories. The families forced into financial ruin because of medical bills. The patients denied care because they couldn't navigate the insurance labyrinth. The doctors trapped in a system that forces them to spend more time on paperwork than with their patients. If you've ever wondered how we ended up with the most expensive, inefficient healthcare system in the world, this book lays it all out. But it's not just books. This conversation is happening in real time, all around us. Follow journalists like Sarah Cliff and Elisabeth Rosenthal, yes, the author of An American Sickness, because they are constantly exposing the latest scams, price hikes, and legal loopholes that keep healthcare costs rising. Watch documentaries like Escape Fire, The Fight to Rescue American Healthcare, which shows how our system rewards quantity over quality, or Bleed Out, a personal story of how one botched surgery turned into a financial and medical nightmare. And here's the thing: you don't have to become a policy expert to make a difference. Just talking about this issue is a form of action. Share what you've learned. Have conversations with friends and family. The more we expose the flaws in the system, the harder it becomes for hospitals, insurers, and drug companies to hide behind them. Because at the end of the day, knowledge is power. The more you understand how the system works, the better equipped you are to fight back. And who knows? Maybe one day, instead of just surviving this system, we'll be the ones to change it. So, where does this leave us? The American healthcare system isn't broken, it's doing exactly what it was designed to do: make money. Hospitals overcharge because they can. Insurance companies negotiate bad deals because it benefits them. Pharmaceutical companies keep drug prices high because there's no one stopping them. And we, the patients, are stuck footing the bill. But here's the good news: we're not powerless. The first step to fixing any problem is understanding it, and now you know the game they're playing. You can question your bills. You can compare prices. You can push back when doctors order unnecessary tests. You can vote for policies and leaders that prioritize patient care over corporate profits. And most importantly, you can keep this conversation going. If this video opened your eyes, share it with someone who needs to hear it. Drop a comment below. Have you ever gotten an outrageous medical bill? Have you fought back? Let's talk about it. The more we expose the flaws in this system, the harder it becomes for those in power to ignore them. And if you want more deep dives like this, don't forget to like, subscribe, and hit that notification bell. We've got more eye-opening breakdowns coming your way, because knowledge is power, and together, we can change the game. Thanks for watching, and I'll see you in the next one. Stay informed, stay empowered.